Hello and welcome. Today we're diving deep into a rare and often overlooked condition affecting the urinary system, bladder lymphoma. While bladder cancer is more commonly associated with this organ, lymphoma can, in some cases, develop in the bladder, presenting unique challenges in diagnosis and treatment. Let's unravel the complexities of this disease. The exact cause of bladder lymphoma, like many lymphomas, is not fully understood. However, several factors are believed to play a role. These include genetic mutations that disrupt normal cell growth and division, leading to uncontrolled proliferation of lymphocytes. Chronic inflammation, potentially caused by persistent urinary tract infections or other underlying bladder conditions, can also increase the risk. Additionally, some individuals with weakened immune systems, perhaps due to autoimmune disorders, HIV, or immunosuppressant medications following organ transplantation, may be more susceptible. Bladder lymphoma develops when lymphocytes, a type of white blood cell that normally fights infection, undergo malignant transformation within the bladder wall. These cancerous lymphocytes accumulate and form tumors that can infiltrate the bladder lining and potentially spread to nearby lymph nodes or even distant organs. The presence of these tumors disrupts the bladder's normal function, impacting its ability to store and empty urine effectively. The resulting inflammation and obstruction can lead to a cascade of symptoms, which we will explore shortly. Bladder lymphoma is considered a rare malignancy, representing a small fraction of all bladder cancers. Precise epidemiological data is limited due to its infrequent occurrence and diagnostic challenges. It is estimated that bladder lymphoma accounts for less than 1% of all bladder malignancies. While it can occur at any age, it tends to be more common in older adults, typically over the age of 60. There is no significant gender predilection observed, with both men and women affected equally. The signs and symptoms of bladder lymphoma can mimic those of more common bladder conditions, making early diagnosis difficult. The most frequently reported symptom is hematuria, or blood in the urine. Other common symptoms include frequent urination, urgency, a burning sensation during urination, difficulty emptying the bladder completely, and lower abdominal pain or discomfort. In advanced stages, if the lymphoma has spread, patients may experience fatigue, weight loss, and swollen lymph nodes. Diagnosing bladder lymphoma typically involves a combination of imaging techniques, cystoscopy, and biopsy. Initially, a urine analysis may reveal the presence of blood or abnormal cells. Imaging studies such as CT scans, MRI, or PT scans can help visualize the bladder and identify any suspicious masses or enlarged lymph nodes. Cystoscopy, a procedure where a thin tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining. A biopsy, where a small tissue sample is taken during cystoscopy, is crucial for confirming the diagnosis of lymphoma and determining the specific type of lymphoma involved. This pathological analysis is essential for guiding treatment decisions. Bladder lymphomas are most commonly classified based on the specific type of lymphoma involved. The most frequent type is diffuse large B-cell lymphoma, DLBCL, a type of non-Hodgkin lymphoma. Other less common types include marginal zomoma, follicular lymphoma, and rarely Hodgkin lymphoma. The specific classification is vital because it impacts the treatment approach and overall prognosis. These classifications are determined through careful microscopic and molecular analysis of the biopsy sample. Treatment for bladder lymphoma depends on several factors, including the type of lymphoma, the stage of the disease, and the patient's overall health. Typically, treatment involves a combination of chemotherapy, immunotherapy, and radiation therapy. Chemotherapy aims to kill cancerous lymphoma cells throughout the body. Immunotherapy, such as with rituximab, targets specific proteins on lymphoma cells, enhancing the immune system's ability to fight the cancer. Radiation therapy may be used to target localized tumors in the bladder. In some cases, surgical removal of the bladder, a cystectomy, may be considered, particularly if the lymphoma is localized and chemotherapy is not effective. A multidisciplinary approach involving oncologists, urologists, and radiation oncologists is crucial for developing an individualized treatment plan. Currently, there are no specific preventative measures for bladder lymphoma, as the exact causes are not fully understood. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, may contribute to overall immune system health and potentially reduce the risk of various cancers. Prompt treatment of urinary tract infections and regular check-ups with your doctor can also help detect any potential issues early. The prognosis for bladder lymphoma varies significantly depending on the type of lymphoma. the stage at diagnosis, and the patient's response to treatment. Generally, patients with localized disease and those who respond well to initial therapy have a more favorable prognosis. Recent advances in lymphoma treatment, including the development of novel immunotherapies and targeted therapies, have improved outcomes for some patients with aggressive forms of lymphoma. Research is ongoing to better understand the genetic and molecular mechanisms driving bladder lymphoma, which could lead to the development of more effective and personalized treatment strategies in the future. These new therapies hold promise for improving long-term survival and quality of life for individuals diagnosed with this challenging disease.